Doctors. We turn to them whenever we need help with any part of our body, be it the heart, the brain, or even our nether regions. However, with so many different specialities to choose, how do we figure out the best one? Which one tops them all?
Salute and welcome to the channel Romaniac, and in this video I will be making a medical specialities tier list. So let's go. Before I start this video, I just want to preface that this is my own personal choice. Do not take this for fact. So if you guys are medical students out there looking at this tier list, using it as a way to recommend a specialty for yourself, don't do that. This is just my own personal choice. This is stuff that I like based on the things that I've gone through in my clinical practice this year, last year, and also things I've done in my job as a healthcare assistant. Before further ado, let's start off with the first one, which is Haematology. Now, haematology is basically the study of blood. So you, as a hematologist, will be having a look at different kind of blood diseases and basically treating them. I think for me, the blood isn't something too interesting for me. Yeah, so I think that's the only reason why I'll just put that in C just for now, and then we'll see later on. Maybe I'll move it around based on the others. And next, number 2, we have anesthesia. Now, I won't lie to you, when I first started medical school, I thought that anesthesia was a bunch of nonsense. When we were in some of our surgical rounds, we had anesthesiologists, of course, as you do in every surgery. However, I did not know what exactly they did. I knew that they administered anesthesia, but they were always there throughout the surgeries, not really, like, for me, it was like they were not really doing much. Since actually studying a little bit of anesthesia and shadowing some anesthesiologists, I have huge respect for them now. I mean, the work that they do before surgeries in terms of making sure the patient can actually have certain types of anesthesia, the work that they do during surgeries, making sure the patient is safe, is comfortable. Also, they're kind of like the chaperone of the patient during the surgery. So for example, when we as students or residents want to do a certain type of procedure that the doctor allows, or the surgeon, the head surgeon who's doing the surgery allows, they have to then speak to the anesthesiologist, and the anesthesiologist has to in turn give them permission to do those certain things. And also the work that they do after the surgery is done, they wake the patient up, make sure they're stable, make sure they're okay. So I have huge respect for them. But with all that being said, I'll put it in D because it's boring, sorry. Next, we have ophthalmology. Now, ophthalmology, if you guys don't know, my dad's an ophthalmologist, so it's a subject that I do know quite well. I have started studying ophthalmology recently this year, and it is a lot of knowledge that you have to go through. However, the life of doctors, ophthalmologists are pretty good. They're known to be pretty relaxed. They have a good amount of time outside of their workplace. A mixture of surgery and just normal clinical work. You have a good relationship with the patients. You study the eyes. I mean, there's a lot of knowledge that you have to go through. However, I think the fact that you do have a lot of time outside of treating patients, like with your family and everything, and the fact that it is what I want to specialize in the future, makes me put it into the S rank. That's the first S rank of the day. Next, we have cardiology. Now, cardiology is probably my favorite surgical round that we've done. That's mainly based on the teacher that I had. However, it's probably my least favorite subject to study because of how much things you have to go through. However, just based on the stuff that we did in the hospitals, the amount of care that you can give patients and how you can help them, I think it's super awesome. So I'm going to put it in A. Now, going on to the next one, it is Paediatrics. Now, Paediatrics is, if I'm being honest, it's not something that I'm really interested in. Taking care of babies is fun and will be fun when I'm a father. However, if I'm doing it every single day, not just babies, I mean small kids, it's not something that interests me a lot. So I'm gonna put it straight into D. And following Paediatrics, I'm just gonna straight away put Gynecology in D as well. It's not what I want to do. Next, we have plastic surgery. Now, if it was just about the money, it would be going straight into S tier. However, since I'm not somebody who cares so much about how much I'm going to earn afterwards, it's not going there. It will have to go into... Actually, no. I think I think plastic surgery is pretty cool, and you do get paid a lot, so I will put it, yeah, I'll put it in S tier. Next we have ENT. Now ENT is a study of the ear, nose and throat. It has a specific name, however I don't know how to say it, so I'm not going to fool myself here. I haven't actually been on an ENT rotation so far, so it's not something that I know so well. However, just thinking about what kind of things you can do in there and whether I do like doing surgeries or treating people in the nose, ear and throat, it's a no. For me, it's not as bad as gynecology or pediatrics, so I'll probably put it in B. As you can see, we're halfway through, and I think the tier list at the moment is looking pretty cool. It's well proportioned, and we have a couple in the D section, which is of course normal, but we do have a range from S all the way down to D. So let's start the second half straight with gastroenterology. Now, gastroenterology is the studies of the whole GI tract, and I think that is something that really interests me. The GI tract is something that's really, I think, is really simple. It's quite clear to understand the whole system. And whenever I've been in surgeries where they are operating on any part of the GI tract, it's always been fun, it's always been cool, really hands-on kind of surgeries. I mean, you do spend a lot of time in surgery when you are a surgeon. However, the surgeries I think are really cool, so I would put it straight into S tier. Now, next we have Orthopaedics, which is something that I did not enjoy at all when I was doing a surgical round because of all the hammering, all of the drilling. It really felt like you were inside like a workshop or something. You were Bob the Builder, and that's not why I came to do medicine. I mean, I think it's too much for me. I remember walking into the surgical room first thing I see is a drill on the table, and then the surgeon takes it and starts drilling. There's so much noise, there's so much hammering. People are pulling the limbs from left, right to center. I mean, for me it was very scary, very daunting, and I didn't like the experience at all. I couldn't focus on what they were doing, the procedure they were doing, because I felt so scared for the patient. I was like, they're breaking the patient's limbs. So for that reason, I will put it straight into the D section. Next is neurosurgery, which is probably one of the hardest specialities to get into in terms of examinations or how smart you have to be, how well you have to place in your grades. For me, it's not something that has ever really interested in me. It is incredibly difficult in terms of as a job. That's why it is so hard to get in. But it has never really interested in me, so I will just put it in B. And now we have GP, something I think everyone has a lot of experience with. GP being general practice. As I'm from the UK, I think another way to say is just general, like a family doctor, let's say it like that. I mean, they know a little bit about a lot, I guess. They're quite well versed. They have good working hours. It's not that long of a specialization. Yeah, so I think with all of those things in mind, you could put it really up to S or A. The fact that you don't get to do a lot of surgeries and you do have to refer people to other specialists when you can't really do anything about them is something that I don't like. I don't really like patients coming to me just to be referred to somebody else, and a lot of the time that's what happens with GPs, as they don't end up really doing any surgeries or anything. But I guess it's really cool if you want to have this really strong bond or relationship with your patients. They come in, they see you all the time, you're very familiar with families or people in the area, so for me is a tie-up between B and C, but I'll put it into C. Next we have neurology, which is not to be mistaken with neurosurgery. Yeah, neurologists don't do surgery, which I think for me is a huge factor when I'm thinking of what speciality to go into. So for that reason, I would have put it in the same boat, same tier as neurosurgery. However, they don't do surgery, so I'll put it one less. I'll put it in C. Next we have oncology, which is something I already know where I'm going to put. However, I do want to preface and say that oncologists do wonderful work. I think everybody, students, medical students, everyone should have some knowledge of cancers and different risk factors and how they affect you, because cancer is something that everybody knows somebody who's either died or has suffered or has gone through that kind of experience, so it's really important for us. However, just the study of cancer every day is not something that I'm really interested in, so unfortunately I'm gonna have to put it into D. Now we've got just a couple left, and at this point I want to ask all of those who are still watching, please leave a like on this video if it's something that you're interested in, and perhaps you've been watching this whole time and you're a dental student, and if you are, just click up here as we have got a dental tier list. done by none other than David. Now we have urology, which is the study of the urinary tract of both females and males. For me, bladder, kidneys, all of that is not something I'm interested in, so I would put that straight into D as well. You are seeing a trend over here. A lot of things I am putting in D, but that's because I've gone through these surgical rounds and I've seen that it's not something that interests me. And you know, medicine is, all the different specialties have such a huge range. So it's perfect. You will always eventually find something that you are interested in, and you will most definitely find a couple things that you absolutely don't want to do. We'll move swiftly on to the penultimate specialty, which is psychology. I think nowadays it's really cool that young people are interested in how the mind works. They want to know why people think certain ways, why some people are a certain way, also to do with depression and other psychological disorders. I think it's really, really awesome that people are reading up on this kind of stuff. For example, David, he's somebody who probably really likes reading up on psychology. I do as well from time to time, but I can't imagine myself being a psychologist full time every single day. I think it would really, really wear me out. So for that reason, I would put it in C. Now, moving on to the final one, which is dermatology. Now, a lot of people will be like, ugh, dermatology or skin diseases, no, not for me. However, I think their working hours are awesome. And after being in a dermatologist's office, just for a few minutes, I think it's pretty cool being in there speaking with the doctor as to what he does on a daily basis. They have a great work-life balance, and I think it's not as icky as people really think it is. I think the kind of things that they deal with are pretty cool. It's pretty interesting to see the different kind of skin diseases. Maybe I'm just crazy and I'm just weird, but I do think it's cool, so I'll put it in A. And that concludes my tier list. Now have a look at it. What do you think I've put in the wrong tier? What do you think I need to change? And put into the comments what you want to be. If you are a medical student and you're looking to specialize soon or in the future, what would you like to specialize in? Put it down into the comments. Mine is ophthalmology. Do you agree with me? Or do you not? Now, if you're interested in studying medicine and you want to figure out how to get a place, look into the description box down below, as we can help you get a place. So if you enjoyed the video, don't forget to subscribe, like, and turn on your post notifications, as it helps our channel grow. If you have any other video ideas that you would like us to do in the future, be it medicine or dentistry, also leave them down in the comments. That was me, Forza from Romaniac, signing out. La revedere and ciao.